The risks of atrial fibrillation are several, and it's important diagnosis to make. The most important risk would be stroke risk. With atrial fibrillation, because the top chamber or the atrium is not contracting, blood clots can form up there, and that's the single most important thing I try to control with atrial fibrillation. That can be life-altering and is probably, in most people's opinion, more scary than death itself. Other risks for atrial fibrillation include if the heart rate's too fast, too long. That can lead to heart failure. And finally, atrial fibrillation can cause a lot of symptoms. It's not a risk, but living life with a lot of palpitations, dizziness, fatigue can lead to risks of just being inactive and not enjoying your life and not being healthy during your life.
There's a number of different factors that increase the risk of stroke in patients that have atrial fibrillation. One is age. Age over 65 and certainly over 75 is a risk factor for stroke. Other risk factors include diabetes, a history of hypertension, a history of prior stroke or a warning stroke called a TIA.